another minute to join before starting. So in the interest of time, I think we will start now. Again, good morning. I am Diane Newfield from the New York Care Coordination Program, filling in for Ruth Colon Wagner this morning. Thank you all for participating in this webinar. Healthcare is confusing enough for me. How can I help? This will be a really exciting webinar, and I'm looking forward to the content. Just a few business matters. If you're watching as a group, please list everyone's name at the end of today's webinar. And please remember to complete the evaluation at the end of the webinar. Evaluations are required if you want CEUs. If you missed the training, everything is recorded and uploaded to the website. And you can email Ruth if you need additional information. We will record your attendance at each event and contact you or your supervisor with links to any of the webinars or videos that you've missed. Please type in your questions throughout the presentation, and Laura hopefully will have the opportunity to answer them at the end. If you have other questions, please visit the website at cmti.nyaprs.org. And if you don't have your questions answered, please contact Ruth by email at Ruth, RUTHCW, @nyaprs.org. Our presenter today is no stranger to us. Laura is a great presenter, and I think maybe 2 webinars ago she was the presenter. And she's the founder and CEO of Complete Compliance Solutions. I won't go through too much of her bio because, again, she presented to us. Laura and her team provide leadership development, training, and education, and she has done a lot in terms of training with care managers across New York State. So welcome, Laura. And I will turn it over to Laura now.
Thank you so much. I really appreciate it. So let's for a moment discuss what the learning objectives are. We want to talk about and define health literacy. We want to understand how it actually impacts the individuals that you work with, and then we want to learn ways in which to increase your clients' health literacy. So what is health literacy? It's the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. October is actually Health Literacy Month. So more than 1 in 2 adults can't use a BMI graph to measure their weight, understand a vaccination chart, or even read the label on a prescription bottle in such a way that they can comprehend what it is they are supposed to do with that medication. 9 out of 10 people lack the skills needed to manage their own health and prevent disease. Health literacy issues and ineffective communication places patients at greater risk of preventable adverse events. If a patient doesn't understand the implications of her or his diagnosis and the importance of prevention and treatment plans, or can't access healthcare services because of a communication problem or an untoward event that may occur. The same is true if the treating physician does not understand the patient or the cultural context within which the patient receives this critical information. The Joint Commission accreditation standards underscores the fundamental right and need for patients to receive information both orally and written about their care in a way that they can understand, not that the provider understands. Research findings on the impact of low health literacy. People with low health literacy have a lower likelihood of getting a flu shot, of understanding medical labels and instructions given them by the doctor, and a greater likelihood of taking medications incorrectly as compared with adults with higher health literacy. Individuals with limited health literacy reported poor health status. They were less likely to use preventative care. They're more likely to be hospitalized and have bad disease outcomes. These are the people you serve. In the Triple Aim outcomes training that we spoke about previously, the desire to decrease hospitalizations and ER visits, as well as increase use of primary care, are the Triple Aim outcomes so greatly impacted by the individual's health literacy. Also, patients can move from reactive to proactive, to move from crisis management to preventative care. But to do this, the patient has to have health literacy. So let's put this in a context for you. Let's look at diabetes, for example. Among primary care patients with type 2 diabetes, inadequate health literacy is independently associated with worse glycemic control and higher rates of retinotherapy. Inadequate health literacy can contribute to the disproportionate burden diabetes-related problems place among disadvantaged populations. Not having health literacy leads to increased amputations. It leads to poor oral care, the loss diabetes impact on the kidney and the liver. So what is health literacy? Well, ironically, Australia has a commission on safety, quality, and healthcare that designates a specific amount of resources to the development of health literacy. So they believe that health literacy has an environmental impact and an individual impact, and so therefore should be tackled from both those arenas. The health literacy environment includes all the areas that make up the health system and have an impact on the way in which people use it. It includes infrastructure, policy, process, access to materials, and the people you meet and the relationships you form when you're using a healthcare system. Health literacy for the individual is the motivation and capacity of the person to access, understand, and appraise and apply the information that's given to them. So let's look at environmental factors. Patients are often faced with complex information and treatment decisions. Providers are often speaking a language that most patients can't even follow, let alone understand. Health literacy is also influenced by systemic factors, the communication skill of the lay person or professional, the lay or professional knowledge of the health topics, the provider's cultural and cultural competency, the demands of the healthcare and the public health system, and the demands of the situation and the context. When you add in all these environmental factors, is there any wonder that patients feel helpless? We are always talking about the population we work with and disadvantaged populations. But when we talk about healthcare literacy, I think it applies to everyone. How many times have you yourself gone to a doctor's office and been turned off or frustrated by the amount of time you spend in a waiting room, by the receptionist that you don't feel you can approach and have a conversation with, by the doctor that you've waited 2 hours to see but has only spent 12 minutes with you person to person and isn't even making eye contact with you. As care managers, you are that individual that can have the greatest impact when it comes to that disengagement, that break in that communication. So health literacy affects people's ability to, one, navigate the healthcare system, filling out forms, simply finding a provider in network or services that they need. Two, share personal information, such as health history with providers. How often has a provider, asked a question and we haven't even known what they were really asking, so we gave answers that weren't applicable to the question we were asked? Three, engage in self-care and chronic disease management. When I train care managers, this is the number one thing I hear. And four, understand the mathematical concepts, such as what's the probability that that will happen? What's the risk if I do these things? Health information can overwhelm even persons with advanced literacy skills. Medical science progresses rapidly. What people may have learned about health or biology during school years often becomes outdated or simply forgotten, or it is incomplete. Moreover, health information provided in a stressful or unfamiliar situation is unlikely to be retained. Navigation. The ability to locate a provider or prescribed ancillary service, as well as filling out the required forms. Managing chronic disease is the ability to act on provided health information for chronic disease management. If we go back to the diabetes scenario, do we understand that sugar includes potatoes, rice, bread, carbohydrates, that sugar is contained in cough syrup, in toothpaste, in other forms? This could include skills that require patients to understand a wide range of information, visually, operate a computer to obtain information, or the ability to obtain and then apply for that information. Communication is the ability to share personal health information with the provider who needs it. Numeracy is being able to measure and appropriately deliver a liquid medication to a child, as well as comparing different health plans. Health literacy requires a complex group of reading, listening, analytical, and decision-making skills, as well as the ability to apply these skills to health situations. So, for example, it includes the ability to understand instructions on a prescription bottle, appointment slips, medical education brochures, doctor's directions and consent forms, and the ability to negotiate the complex healthcare system that we have. So, in order to accomplish these things, individuals have to be what's called visually literate, able to understand graphs, pictures, or other visual information. They have to be computer literate. So many of our providers and healthcare plans now direct everyone to a website or a patient portal. They have to be information literate. They have to be able to obtain and apply relevant information that they need. And they have to be numerically or computer literate, able to calculate or reason numerically. Oral language skills are important as well. Patients need to articulate their health concerns and describe their symptoms accurately. Spoken medical advice or treatment directions have to be able to be reiterated back to the doctor or provider. In an age of shared responsibility between the physician and the patient for health care, patients need a strong decision-making skill set. With the development of the internet as a source of health information, health literacy may also include the ability to search on the internet and evaluate different websites. So what's the prevalence of low literacy? Well, according to the Agency for Healthcare Research and Quality report, low health literacy is linked to the higher risk of death and more emergency room visits and hospitalizations, two of our triple aim outcomes. Health literacy may not be related to years of education or general reading ability. A person who functions adequately at home or work may have marginal or inadequate health literacy in a healthcare environment. People with low health literacy use more healthcare services. They have a greater risk for hospitalization and a higher utilization of expensive services such as emergency care and inpatient admission. Two of our triple aim outcomes. Vulnerable populations for low health literacy include older adults, immigrant populations, minority populations, and low income. 24 million Americans are not proficient in English. And by proficient, we're talking from a health literacy standard. You can be conversant in a language, and yet when you get into specificity around healthcare and the language of healthcare, we can be illiterate. 1 in 3 American adults are in a basic or below basic health literacy group. The average American reads at a 7th grade level. How many health information brochures are written at a 7th grade level? 9 out of 10 adults have a difficult time using health information that is available in healthcare facilities. Think of all the brochures sitting at the local pharmacy or at your doctor's office. How helpful are they if we really can't understand what it is we're reading? So why do we have limited literacy skills? Lack of educational opportunity, people with a high school education or lower, learning disabilities, particularly in populations age 40 and above, which did not have those types of services or even the diagnosis and screening in their childhood, cognitive decline in older adults, or the old concept of use it or lose it. Reading abilities are typically 3 to 5 grade levels below the last year of school completed. As a result, people with a high school diploma typically read at a 7th or 8th grade level. The relationship between literacy and health is complex. Literacy impacts health knowledge, health status, the access to health services. Several socioeconomic factors impact health status. Literacy impacts income level, occupation, education, housing, and access to medical care. Poor and illiterate individuals are more likely to work under hazardous conditions and be exposed to environmental toxins, which makes it even more important to have a higher health literacy. So let's take a minute and also look at it from a cultural context. Recognizing that culture plays an important role in communication helps us better understand health literacy. For people from different cultural backgrounds, health literacy is affected by a belief system, communication style, and an understanding and response to the health information. Even though culture is only one part of health literacy, it is an important piece. There is a move toward patient-centered care. Healthcare as part of an overall effort to improve the quality of healthcare and to reduce costs. You guys live this every single day. And individual patients and providers need to work together to ensure the effective communication. Patients need to take an active role in health-related decisions. But how do they do that if they don't even understand what their options are and what impact those options will have on their life? So now that I've frightened you and I've told you all the reasons that we have poor health literacy, what do? Well, care managers can be that X factor that makes health literacy possible. So what can you do? You can help individuals seek information. You can help them be honest and open. You can be honest and open and based on what the provider has said and help them to understand. You then have a responsibility to make sure they do understand. And you've had many trainings on active listening. You can use those skill sets in reverse and ask the patient to repeat back to you what they think they have heard. You can review instructions on medicine bottles. You can act as an interpreter. Low health literacy was once viewed as an individual patient's deficit. That is, a patient's lack of knowledge and skills regarding health issues. But we now recognize that health literacy is a system issue, reflecting the complexity of both the presentation of the health information by the provider and the navigation of the healthcare system. But we know as care managers that the answer still isn't that simple. So how can we change the system? You are the beginning of that change. We have to start with including health literacy in our care coordination with providers. We need to become the advocate, if necessary, for our clients to help prepare them to hold not only themselves accountable, but their providers accountable. If you're in an office and that individual does not understand what's being said, you have to help them advocate with their provider to say, I'm not understanding. You need to not use jargon, not use medical lingo, and you need to speak to me in a simple language. So you can't walk into a room and think every single person on your caseload has low health literacy. You have to figure out how to measure it. So we've provided a link here, but I've also in the handouts have given you a tool, but I want to go over how you would use these tools. So the SOL-E is a health literacy tool. The directions to the interviewer are that before the test, the interviewer should say to the individual, I'm going to show you cards with 3 words on them. First, I'd like you to read the top word out loud. Next, I'll read the 2 words underneath, and I'd like you to tell me which of the 2 words is similar or has the closest meaning to the word that I shared with you at the top. If you don't know, you can just say, I don't know, please don't guess. You show the examinee the first card, so you say something like kidney, or they read kidney, you say urine and fever. They should select one of the 2 or say, I don't know. As you go through this test and you continue the test with the cards, a correct answer for each test item is determined by both the correct pronunciation and the accurate association, not simply guessing the right word. Each correct answer gets a point. Once the test is completed, the interviewer should tally all the points. A score between 0 and 14 suggests low health literacy. Simple test, easy to help you understand what it is the individual has some basic knowledge about. So if you have multiple diagnoses for this individual, you're able to use this 3-card system to see, do they even know what functionality in the body is associated with the diagnosis that they have. The other test is the Realm SF. So providers often use words that patients don't understand. We are looking at words providers often use with their patients in order to improve communication between the healthcare provider and the patient. So here's a list of some medical words. Starting at the top of the list, please read each word aloud for me. If you don't recognize the word, say pass, or move to the next word. You give the participant the list. If the participant takes more than 5 seconds on the word, you say pass. This measures a 3rd grade level or below understanding of health literacy. 1 to 3 is a 4th grade level, 0 is 3rd grade, 4 to 6 is a 7th grade level, and 7 is a high school grade level of understanding. It will give you some idea. This is a short and quick test that works really well, especially if you're going to work with your client or participant on setting up different appointments with other providers, and they express to you that nobody ever listens to them, they don't understand the directions given, this can help you understand where they are on the health literacy scale. I often found when I was in practice that my clients that did not do follow-up visits, did not really engage with other providers, tended to have low health literacy and felt inadequate with the provider, so they chose not to go. So how do you respond? So now you know which clients have low health literacy. Well, that's lovely, except that doesn't do anything to make the situation better. So once you understand how much health literacy someone has, now you need to understand how to respond. Information accessibility. You as care managers can create collections or repositories of materials, insurance forms, instructions, health proxies, advance directives, other legal documents, aftercare, medication instructions, illness-specific patient education materials. These things are available online. They're available both in narrative and pictorially, so that you can review them with the member that you're working with as they receive information. You have to help them to disseminate existing communication tools and resource it for the patients. Not all of your patients have access to the internet. It's a good thing for you to be able to actually have resources available. So there is a thing online called a consumer health librarian. And you can Google that phrase, and they have support and direct needs health information for consumers. They have materials available that's multilingual, culturally appropriate, and easy to read. And by developing methods and materials to teach consumers how to evaluate health information resources, you help increase their health literacy. It's also important to empower our clients. We talk about this all the time. It's very difficult for patients to do what they don't understand. So the first step in equipping patients to take on one more active role in their healthcare is to educate them. Start by communicating to patients that education is perhaps as important to their health as getting their prescription filled. They need to know about their disease. We talked about diabetes earlier. The concept that, well, if I get my sugar down, then I'm cured. I don't have to manage my diabetes. We talk about how that's the same as when we have people who are non-adherent to psychotropic medication, right? So if someone isn't taking their medication, it's because they felt good on it for a few weeks or a few months, they believe they're cured, they stop their medication, and then they don't take it anymore, and then they decompensate and they have another crisis. If they don't take their insulin, if they don't watch their diet because they were stable with their diabetes and they stop doing their maintenance or management care, they then have a diabetic crisis. So we need to be more effective in helping individuals understand not only the impact today, but the impact of if I choose path A and remain compliant with my medication and my treatment course, this is my typical outcome. If I don't choose that, then this is the most likely outcome. But just as patient-centered care can be more effective, patient-centered education is better education. The old education program, where you bring people in, you sit them down and lecture them, doesn't work any better than bringing them in and sitting them down and telling them, hey, go lose 20 pounds. Have a nice day. Instead, the patient's needs should drive the education. So for example, our center is testing diabetes education courses based entirely on questions from the audience. We don't have a checklist. We do have a checklist of topics we want to cover, but we address those topics in the context of the patient's questions rather than through a lecture. Patients aren't interested in their disease from an intellectual perspective. They want to know how that disease impacts them. What does this mean to me? How is this different to me? How does this affect my life? I don't care how it affected my neighbor's life or every other patient or client that you work with. Engagement. In care management, we talk about patient engagement as making and keeping appointments. But in health literacy, patient engagement is about an individual's willingness and ability to advocate for themselves and to make informed decisions in their best interest. That doesn't mean what we think is their best interest. It means what works best for them in their life circumstances. Patient engagement in self-care requires active and involved patients. This model of care can be described various terms: empowerment, informed choice, patient-centered care. The terms have changed over the decades, but they all have the same underlying concept. The patient is at the center and is actively involved in their own healthcare decisions. So today's phrase, 2018, is person-centered care. The old models of care where providers tell the patients what to do and try to motivate them to change don't work, right? How the United States is suffering from a crisis with obesity. You don't think doctors have been telling patients for years, hey, I think you should lose some weight. Simply saying that doesn't matter. We have to be motivated. We have to understand what it is that is so impactful to us that it motivates us to change a behavior. Because patients' day-to-day decisions have a tremendous impact on their health, they have to be active, informed in the process of healthcare. Providers can help patients take charge of their conditions by encouraging them to set self-management goals. This is something a care manager can do with their client. First, most chronic illness care does not even involve physicians and other healthcare professionals. Instead, it's estimated that between 95 and 99% of chronic illness care is given by the person who has the illness. On a day-to-day basis, the patient is in charge of their health, and the daily decisions people make have a huge impact on their outcomes and on the overall quality of their life. Second, as a physician, they believe they know what's best for treating that disease, diabetes, asthma, congestive heart failure, but that doesn't mean they necessarily know what's best for the individual patient. Even in a close doctor-patient relationship, you can't always know the detail of a patient's life. What's most important to them? Are they a caregiver at home? Is there someone else they're responsible for? Do they work 2 jobs, 3 jobs? Do they not have childcare or transportation? Each patient is an expert on their own life. And finally, we know from many studies that when patients are encouraged to be more involved and when their physicians are less prescriptive, patients have better outcomes. We also know that this approach does not take any more time, but in fact is more efficient because in the overall healthcare process, the patient becomes stable and there are fewer visits, fewer crises, fewer hospital ER visits, and fewer admissions. So let's look, for example, at the old model, new model. I hate this exercise plan. The old model, the provider would say, then try walking after dinner every night with your husband for 10 minutes or your partner. The new model then doesn't give a directive. It asks, why do you hate it? What do you think would do better? We are more likely to follow through with something if the suggestion and idea was our own. I don't think I can quit smoking. Well, you know, smoking is the leading cause of preventable death. No one quits smoking because you've said that. They've had it on the side of the cigarette pack forever and a day. We've all read it, moved on. As an ex-smoker, I can tell you that was not what got me to stop. In the new model, you have to say, well, why do you think that? What's happened in the past when you've tried to quit? Have you ever tried to quit before? Can we only talk about quitting for a day? Can we talk about reducing instead of quitting? What concerns you? I haven't been able to test my blood sugar 4 times a day. It's hard at first, but you just have to keep trying. Well, what about asking what's preventing you from doing that? I have a small child at home and a parent that I care for. Do you know what the numbers mean and why you should be testing? Is there a better time of day to test if you can't test as often? Patient-centered messaging. Their illness is serious. There's still patients out there who believe they have a not-so-serious kind of diabetes. If they don't believe it's a problem, they're never going to make the changes to improve their health. Some patients believe their condition is essentially self-managed. Every decision the patient makes throughout the day, from what they eat to whether they walk, ride a bus, whether they has an influence on their health. And they don't understand that every single decision they make through the course of the day impacts their health. They have options. There is rarely one perfect way to treat a condition. In the case of diabetes, patients can be treated through diet and exercise, medication, insulin, so on. Patients need to understand the different options available to them so that they can make choices that fit their lives. Because if it fits their lives, they're more likely to follow through. And they have to believe they can change their behavior. Well, I'm 56 years old. I've been doing this for 40 years. I'm not going to change now. Rarely do patients leave a doctor's office or a provider's office and immediately go enact whatever change was recommended. Oh, well, I'm throwing these cigarettes out. I'm never smoking again. The reality is that it often has to be spread out over a series of steps. Teach patients that significant behavioral change can be made by setting small goals. Small. Taking that first step and figuring out what you learn about yourself along the way. So what's your role? Well, you can use motivational interviewing. You've had tremendous amount of training on that. Ask open-ended questions to assess the patient's understanding of written material, including prescription labels. Have you ever asked your client to come in with all of their prescriptions and go over the labels and instructions with them? If they get handed a brochure or a piece of information from a primary care provider, have they brought it to you so that you can help them understand what it says and what it's implying they should do? Use Teachback. So there is a link here for Teachback. It is a communication method to determine if the patient understood the instructions and can repeat the information. It's a new name for active listening in reverse. Use what I call showback. When teaching a patient to use a device or perform a particular task, ask them to demonstrate it for you. Hand your patient written materials upside down while discussing it and observe whether they turn it right side up. If they can't read it, if they're not engaged, if they can't understand it, they typically will not turn the paperwork the right way. Use simple language. Avoid complicated medical terminology. Say swallow instead of take. Say harmful instead of adverse. Say fat instead of lipids. Say belly instead of abdomen. And I realize you're not the prescriber, but if you're advocating with them and going with them to the doctor, these are things you can share with a provider. And if you're reviewing prescription bottles and you're reviewing pamphlets, you can act as the translator. Speak more slowly when you provide instructions than when you're having just a conversation. Be respectful and clear without patronizing. Use graphs and pictures instead of long written instructions. When I've done this in the past with patients, I've actually taken prescription bottles and I've asked them, how would you draw a pill? How would you draw every 2 hours? How would you draw with water? How would you draw stay out of the sun? And they create their own pictorial instruction for that particular pill. Provide information at an appropriate grade level, and not grade level for just regular literacy, but for health literacy. So use those screening tools that we gave you. So this is a sample of a health literacy plan specific to high blood pressure. I picked something I thought you might like, or not like, but would have more clients with. Notice the detail and the concrete approach. This can be done with the provider in an appointment. Health literacy planning. So what is my actual blood pressure? What am I shooting for? That's the ideal, but what is my goal? Blood pressure has 2 readings, 2 numbers. Do I understand what those 2 numbers are? When I go to the doctor and my doctor says it's 145/78, everything I read online says anything over 140 is too high, but my doctor goes, oh, that's not bad. As an individual, how do I take those 2 pieces of information and make sense of them? How do I lower my blood pressure? What are the things that I can do? This is a wonderful plan that you can put together for following behavior modification, for diabetes, for high blood pressure, for smoking, for weight management. It's a simple plan. It's made with the individual, preferably with the provider, but if they're not willing, you can certainly do it with them. And I like to actually do it on index cards, the larger index cards, so the individual leaves with something tactile that they typically can have readily available to them. So this is what I was talking about when I said there was a link, but I also made a slide for Teachback. So what is it? Well, it's a way to make sure that a healthcare provider explained information clearly. It's not a test, it's not a quiz. It's about asking the patient or even a family member or a guardian or an important person in that life, it could be a caregiver, to explain in their own words what they need to know or do in a caring way. Active listening in reverse. A way to check for understanding, and if needed, to re-explain it and then check again. It's research-based, and I've included a link here. This is what providers are calling active listening, but prompted by the provider, and the link in the slide will take you to a toolkit for those services. So, universal precautions approach. A universal precautions approach means treating all patients as if they're at risk for not understanding. So, universal precaution means we double glove whenever there's fluids. EMTs, police, you don't know whether someone has a contagious disease, you don't know whether or not they have anything, but you double glove anyway. It's flu season, you wear a mask. You may not be around someone that has the flu, but you're taking a universal precaution. You can do that with health literacy as well. You can start with the assumption that they have low health literacy and act in a way that allows you to simply start at the most basic level. So here's another hyperlink. I love this hyperlink. There is a website in which you go to where there are, I think, 22 modules in the toolkit, and they have things like, it's called a Health Literacy Precautions Toolkit. So how do you create a health literacy improvement plan? That little card is there. You can click on it, it takes you to it, you can clean it out. How do you raise awareness with your clients? How to communicate clearly using the Teachback method. How do you follow up with patients and make sure that they're following the things that have given them? It's called conducting a brown bag medication review, one of my favorites. So let's show you that for a second so you can see how great it is. So a brown bag review says all the medications come in. You prepare for the review. A nurse, a medical assistant, a care manager can say, We need to make sure that you bring in all your medicines and we're going to review them. You take a photograph of the medication bottle. You can ask the patient. Each bottle they pick up, each prescription they pick up, what do you take this medicine for? When do you take this medicine? Can you show me how much you take of this medicine? So if you're in a residential facility, this is typically done by the facility. But if you live out on your own and you're simply seeing different doctors and you're getting a ton of different pills, it used to be years ago, I'm going to show my age, that pharmacists used to do this, but it's no longer done. If you find that you have a client that is not adhering to all of their prescribed medications, or says they are but tends to have a number of crises, or tends to have different complications to their chronic illness, it might be beneficial to make an appointment with a primary care and do what's called a brown bag review. Make sure they're actually taking the medicines at the same time. I've given this out in the past. It's AARP's website. They have a medication lookup where you can put in 20 medications, prescription and over the counter, and it tells you that if you take your blood pressure, I'm making this up, if you take your blood pressure medication the same time you take your multivitamin or eat a grapefruit, that you'll have an adverse reaction, that there needs to be 4 hours between. How many providers tell our patients don't eat a grapefruit? So a brown bag review is very helpful to most of our patients. Let's see. Okay. So here's what I want to do. We have about 14 minutes left. I want to go through the resources that I've provided you. There are wonderful resources in the Agency for Health Research and Quality, and they're designed for the patient, not for the provider. So we have one on healthcare overall, specifically about healthy men and what they need to do to be involved and engaged consumers, planning for care, how an individual can actually prepare and plan for the healthcare they're going to receive, understanding diagnosis and treatment, and then there's a whole website of patient and consumer information that I thought you guys would find particularly helpful. So let's open the floor for questions. Diane, do we have any questions?
I have one question. Do you have more templates for health literacy planning such as this one on blood pressure?
So if you go to the link, let me go back. If you go to this, if you go to this link on slide 34, when you go look at the deck, it's on slide 34. In that link, there's an index, and the index includes a link on health literacy planning, and it offers more than one option there. I didn't want to put them all in, but so I'll go through the options. How to make an action plan or health literacy plan, how to encourage questioning, to teach clients to question what's happening and to make it clear that they're not understanding something. There's even a tool on how to help patients remember how and when to take their medication. Getting patients feedback, linking patients to non-medical support, connecting patients with literacy and math resources, specifically around understanding how many hours, how many pills, what's the dosage. And there's a whole list in that webpage of another, I think, 120 internet resources. There's so much information available on health literacy and so many tools available to you.
Okay, so while we wait on folks to write in their questions, I'll remind you all of the regional online office hours. And we're asking that you participate in at least one of the two options offered for your region. And they're all listed here.
So I'm going to kill a little time. The thing that I think that's important, and one of the things that's very different about this training than the others I've done, and I've done a few of them, is we so often are discussing topics that are really applicable to the populations we serve, right? So when we talk about AAA outcomes, increased primary care, reduced emergency room, preventable emergency room, and preventable admissions, we tend to see a higher demonstration or usage of those things and a lack of primary care usage in populations at so low socioeconomic status. But health literacy is different. Health literacy is something that you can apply to yourself, to somebody that goes and sees a private physician that has all the resources in the world available to them, to someone with a low socioeconomic status or literacy level. Health literacy and the low health literacy and the lack of understanding around healthcare and how it impacts on a daily basis has no boundaries, no socioeconomic borders. Poor health literacy is endemic in the healthcare system. And here's the interesting thing. As we start to educate ourselves, as we start to engage and advocate for ourselves, the providers are ill-prepared. They're not used to people questioning and advocating, and often the providers will feel as they're being challenged. So I think one of the things you also need to be prepared to help your clients with, help yourself with, is figuring out how to say something in a way that you can be heard. There's 7 ways to say something. I can walk in and I can say, well, I'm not going to do that. That doesn't work for me, which sounds confrontational. Or I can go in and I can say, I don't think I've shared my life circumstances. I haven't shared what's going on in my life with you that makes what you're asking me to do very difficult. Can you help me with that? We have to be prepared not only to increase our health literacy, but to learn how to educate our providers. Because our providers are used to being able to write the script, give us instruction, and walk away with an expectation of us following it. So I train on a lot of different topics, and one of the things that drives me crazy is people constantly talk about patient non-compliance with medication. Patients can never be non-compliant because the patient is the decision maker. I can't be non-compliant with my own decision. I can be non-adherent, where the doctor has suggested and recommended this particular course of treatment, and I am not adhering to that course of treatment, but I can't be non-compliant. And that's what I'm talking about. A provider will see when someone does not follow their instructions to the letter, oh, well, you're just non-compliant, you're not engaged, I'm done. We have to help educate them for ourselves, for our clients, for our children, for our partners, for our parents. We are not being non-compliant. We are not able to be adherent because of these circumstances. And I'm asking you to work with me to help me come up with something I can be adherent to. So not only as care managers are you going to be educating your clients, you're going to be educating their providers. Did we get any more questions?
Well, Colleen was asking, how do I get a copy of this presentation so I can access the links? The presentation is on the website at cmti.niapers.org.
So
CMTI.niapers.org.
There you go.
All right, so there are no more questions. I want to thank Laura for this exciting presentation. I am not a care manager, but I can tell you I can use all of this material. And I don't think there are any other questions, but if you have questions after this, feel free to email Ruth, and we'll have your questions answered, and we'll send back an email to you with the responses. And we're reminding you to go online to niapers.org, and you can see the presentation.
And the handout, right, Diane?
And the handouts, yes. There are some toolkits there as well, which will be very useful, and they're all online.
Okay.
So thank you very much for joining us. Thank you, Laura. I know you have
no problem.
yes, thank you so much.
Have a great day,
everyone.
everybody.